This teaching video about the treatment of ectopic pregnancy is meant for medical students. Who are the candidates for medical management of ectopic pregnancy with methotrexate? Methotrexate for ectopic pregnancy has comparable efficacy to surgical treatment and has similar fertility outcomes. That is, their chance of becoming pregnant again is same for surgery or with methotrexate treatment. Methotrexate is the preferred treatment option when all these 6 characters are present. 1. They should be hemodynamically stable. Their beta HCG concentration should be less than 5000 milli-international units per ml. Transvaginal ultrasound should not show fetal cardiac activity. Presence of fetal heart activity is a contraindication for methotrexate. 4. The ectopic mass size should be less than 4 centimeters. An adnexal mass on transvaginal ultrasound is the most common finding in suspected ectopic pregnancies. This mass should be less than 4 centimeters for the patient to be taken up for methotrexate treatment. 5. The patient should have adequate follow-up and they should have access to emergency medical service in case of a ruptured fallopian tube while the patients are on follow-up. What are the absolute contraindications to methotrexate therapy? 1. Presence of an intrauterine pregnancy. 2. Ruptured ectopic pregnancy. And 3. Hemodynamically unstable patient. These patients usually need surgery. Evidence of immunodeficiency because methotrexate can further aggravate the immunodeficiency. Moderate to severe anemia, leukopenia or thrombocytopenia because methotrexate can cause bone marrow dysfunction. And sensitivity to methotrexate. 7. Active pulmonary disease. 8. Active peptic ulcer disease. Clinically important hepatic dysfunction and clinically important renal dysfunction, breastfeeding, and lastly 12. Inability to participate in follow-up. What are the relative contraindications? Cardiac activity detected by transvaginal ultrasound. A high initial HCG concentration. Ectopic pregnancy mass greater than 4 centimeter in size. And 4. Refusal to accept blood transfusion. What initial HCG level is a contraindication for methotrexate treatment? An HCG level of more than 5000 milli-international units per ml. This is only a relative contraindication. There is a failure rate of 15% or higher when the initial HCG is more than 5000. If the initial HCG is less than 5000, the failure rate is just 4%. Question: which is not a contraindication for methotrexate treatment? Liver disease, B. Kidney disease, asthma, leukopenia, thrombocytopenia. The answer is C. Asthma. Methotrexate is not used in women with liver or kidney disease. This is because it is directly toxic to the hepatocytes and it is cleared from the body by renal excretion. Methotrexate affects all rapidly dividing tissues within the body like bone marrow, gastrointestinal mucosa or respiratory epithelium. Therefore, methotrexate should not be given to people with blood dyscrasias or active gastrointestinal or respiratory diseases. However, asthma is not an exclusion criteria for methotrexate. Which tests should be performed before methotrexate treatment? 1. Transvaginal ultrasound. This is part of the diagnostic evaluation. This is absolutely necessary to rule out a viable intrauterine pregnancy, which is an absolute contraindication for methotrexate therapy. Serum beta HCG is also part of the diagnostic evaluation. In addition, this is needed as a baseline to monitor the effect of therapy with methotrexate. Blood type and screen is to determine the need for anti-D immunoglobulin in patients who are anti-RSD negative. Renal function tests and liver function tests and complete blood count are needed to assess for the contraindications to methotrexate therapy.